I'm Dr. James Lozada. I'd like to tell you about a project we've been working on for 2 years aimed at reducing the rate of blood transfusions for patients having total knee and total hip replacements. Now, blood transfusions increase morbidity and mortality, cost, and hospital days. We are screening preoperatively for anemia, treating it, and measuring transfusion rates. I'd like you to meet one of our patients. She's having her second total knee replacement and is perfect for this project.
Put your nickel in. There.
Retired draftsman Darlene Adair finally has time for her passions. 3 days a week, she's at the local senior center, teaching card games, cooking, and making friends. Joy fills her heart, but pain courses her joints, making days like this tough.
Walking is just painful. I'm afraid that I'm going to fall.
Doctors replaced Darlene's left knee in 2012, and she'll soon have her right knee replaced by the same surgeon. She hopes recovery this time is smoother.
I was just weaker than a kitten.
Darlene!
Her world started spinning while standing up for the first time after surgery. She couldn't move and was short of breath.
I was real scared. I thought I was ready to die.
Nurses quickly called a rapid response. Her hemoglobin had dropped 5 grams, and she needed a blood transfusion.
I was finally able to get up and walk a few steps with the walker.
Blood loss averages 2 liters during lower extremity total joint arthroplasty, according to many studies, and frequently requires blood transfusion. Our institution has historically followed this trend, so we partnered with orthopedic surgeon colleagues to launch a preoperative anemia pilot study.
Here's how our protocol works. Several months before elective surgery, the surgeon orders a pre-op anemia screen. If the hemoglobin is less than 13, reflex iron studies are drawn. And then if patients meet criteria for either iron deficiency anemia or perioperative anemia based on those values there, they have either iron dextran or Epogen ordered.
What have we told you about iron?
It's 4 weeks before Darlene's scheduled knee replacement.
Great shape.
Her preoperative screening revealed iron deficiency anemia, so she's here for a 1-gram iron dextran infusion to optimize her hemoglobin.
We looked at 152 cases over a 1-year period. 66 of those patients were anemic, and half of them were treated with iron or EPO. Systems challenges and patient compliance prevented treatment of the others. Now, before initiation of our study, the transfusion rate was 46%. Since we started, it's dropped all the way to 17%. We also see a big difference in the transfusion rate between anemic and non-anemic patients. Anemic patients, the rate is 33%. Non-anemic patients, transfusion rate is 5%. And looking closer at those patients who are anemic, there's a difference in transfusion rate between those treated and not treated. Treated patients, the transfusion rate is 30%, and non-treated patients, transfusion rate is 36%.
Our analysis highlights the high price of perioperative anemia, more than $1,100 per patient in transfusion-related costs and an extra day in the hospital. Darlene looks forward to more strength, energy, and less pain.
Hopefully it'll help me exercise a little more so I won't sit on my butt and be so fat, you know.
This project has helped reduce perioperative blood transfusion rates, and we are expanding it to other services. Now, we're currently only treating a subset of anemia, so next steps include expanding the reflex labs for a better anemia assessment and looking at ways to ensure optimization. Finally, we continue efforts to better coordinate patient care and treatment in the perisurgical home. I'm Dr. James Lozada at the University of Texas Medical Branch.
UTMB Health, working together to work wonders.